This hearing will come to order. Today we meet to hear from U.S. Department of Health and Human Services Secretary Robert F. Kennedy, Jr. about President Trump's 2026 health care agenda. Mr. Secretary, thank you for being here. While I expect a spirited debate today, I would remind my colleagues that each senator is limited to 5 minutes, and we're going to try to keep that as tight as we can today. There's 27 of us, and we all probably are going to want to have our opportunity. At the end of the 5-minute time frame, I will gently tap the gavel if it appears that things are starting to lapse over, and encourage my colleagues and our witness to conclude their remarks at the conclusion of this time. President Trump and Secretary Kennedy have made a steadfast commitment to make America healthy again. Under this administration, HHS has placed patients at the center of the healthcare system, empowering them with the tools and information they need to create a healthier future. We know that chronic diseases such as heart disease and cancer and diabetes are some of the leading causes of death in America. Now the department has a renewed focus on tackling the root causes of chronic disease and promoting prevention first. I look forward to exploring ways that the federal government can further align payment incentives to support healthy living and fight chronic disease. The administration has also prioritized efforts to end waste, fraud, and abuse in our federal health care programs, including through eligibility and enrollment verification. This critical work is not just about saving taxpayer dollars. It's about restoring trust and ensuring vital programs like Medicare and Medicaid are sustainable for generations to come. In July, the Centers for Medicare and Medicaid Services, CMS, announced that the agency identified 2.8 million Americans who were simultaneously enrolled in multiple Medicaid or Affordable Care Act exchange plans. Stopping this duplicate enrollment while working with states to ensure that individuals do not inappropriately lose coverage has the potential to save taxpayers $14 billion annually. CMS has also taken steps to provide states with additional immigration information to verify eligibility for federal health care programs. Preserving lifelines like Medicaid for those who are legally entitled under the law will ensure long-term sustainability. Congress has bolstered these efforts by passing the One Big Beautiful Bill. This bill enacts common sense reforms to reduce improper payments and brings needed personal accountability to the Medicaid program. These reforms will protect Medicaid and refocus the program on the most vulnerable patients, those whom the program was intended to serve. The OBBA also created the Rural Health Transformation Program, the single largest investment in rural health care in decades, to help stabilize and modernize the rural health delivery system throughout our country. These accomplishments reflect a vision for a healthcare system that is proactive, efficient, and patient-centered. While many of the issues discussed today may be partisan in nature, this committee has a deep history of bipartisan healthcare accomplishments. I remain committed to partnering with this administration and Ranking Member Wyden to enact policies that realign incentives in the prescription drug supply chain, expand access to telehealth, and ensure long-term stability in our physician payment system. Mr. Secretary, I look forward to hearing from you today about the administration's efforts to make America healthy again and how we can continue to work together to achieve this shared goal. Thank you very much. Senator Wyden.